Welcome, everyone. Today we're doing a deep dive into adult foster care, AFC. It's a really interesting way to think about caring for loved ones who maybe need a little extra help.
Yeah, exactly.
And we'll be looking at this great guide from Informatix Health. They really specialize in AFC services, but we want to zoom out a little, give everyone a solid understanding of AFC as a whole, what it is and all that.
Absolutely. We'll look at how AFC fits in with, the whole healthcare picture, especially with more and more folks getting older these days.
So let's just start with, the basics. What is adult foster care?
Okay, so at its heart, AFC is all about giving people the chance to get care in a home, like a real home setting,
Right.
And we're talking about people who need help with what we call activities of daily living, things like, bathing, getting dressed, eating.
So it's instead of having to move someone to a care facility, you're bringing that support to them.
Exactly. And keeping them in a place where they feel, comfortable and safe.
Yeah, that makes sense. But I'm curious, is it just like a family member deciding, hey, I'm going to be a caregiver now, or is there more to it?
No, it's definitely, it's more structured than that, AFC actually works within a whole network of, stakeholders, I guess you could call them. We're talking about state agencies, healthcare pros, and organizations like, the one we mentioned earlier, Informatix Health.
So there's oversight?
Oh, yeah. Definitely, to make sure the care is, good quality. AFC programs are usually licensed. They're monitored by state agencies. Plus, you've got healthcare professionals like registered nurses, social workers. They're all involved.
I see. So it's not just someone doing this on their own. So how did this whole thing even get started? Was AFC always around?
Well, no, not really. It kind of came about in the middle of the 20th century, partly because people started getting worried about, institutionalization. As people realized that nursing homes could have some downsides, they started looking for other ways to, let people age in their own homes, surrounded by people they love.
Interesting. It sounds like a big shift toward more personalized care.
Yeah, for sure. AFC is all about recognizing that each person has their own, unique needs and preferences, and the care should be, tailored to that individual.
Yeah. So thinking about who benefits from AFC, the guide mentions a couple examples. Maria, a 72-year-old woman with Parkinson's, and James, a 45-year-old guy with a traumatic brain injury. So it seems like AFC's for a pretty wide range of people, right?
Right. You got it. It can help older folks, people with disabilities, those dealing with chronic illnesses, really anyone over 18 who needs help with, those activities of daily living we talked about. But, and this is key, they want to stay at home.
Right. And the guide really stresses the emotional benefits of all that. Like
Right.
Staying in a familiar place, keeping your routines, especially for people who might be struggling with, cognitive issues.
Oh, absolutely. For someone with, say, Alzheimer's or dementia, being in a familiar environment can be so important. I mean, it can give them a sense of security, keep them grounded, their belongings, their routines, even just the smells and sounds of home. It can really help reduce anxiety and confusion.
Yeah. It's like you're holding on to a little piece of your world, even when things are getting, tougher.
Exactly. And it's not just about the person getting care. AFC lets families stay involved. It's easier to visit. They can even participate in the caregiving.
Oh, I see. So it's not just about, placing someone somewhere. It's about maintaining those family connections.
Absolutely. And for a lot of families, that's priceless. Being able to share meals, tell stories, just being there for their loved one, even when they need more help.
That's really beautiful. But let's be real for a second. I mean, not everyone can just become a caregiver overnight, right? What kind of support is out there for people taking on this role?
Well, that's where that network we were talking about comes in. Groups like Informatix Health and the state agencies, they offer a lot of support to caregivers.
Okay, so they're not just thrown in the deep end.
No. They get training on everything. From the basic caregiving skills to understanding specific medical conditions.
Right. So they're equipped to actually provide good care.
Exactly. And it goes beyond just, the practical stuff. Caregivers get emotional support too. Access to resources like support groups. And, they get guidance from the healthcare professionals the whole way through.
That's so important. Because caregiving can be really tough, right? Physically and emotionally.
Oh, yeah, for sure. And that brings us to another big piece of AFC, the money part, how it all works financially.
You mentioned state agencies before. Does that mean there's public funding for AFC?
Yeah, a lot of times. AFC often gets funded through Medicaid waivers or other state programs, the ones that are set up to help people who need long-term care. These programs can help cover the costs of care, like even caregiver stipends, where the caregiver actually gets paid.
So caregivers can get compensated for their time. Wow, that's huge, especially if like a family member has to cut back on work or something to provide care.
Right, it is. It makes AFC a real possibility for families from all kinds of, backgrounds.
Yeah.
Because good home-based care shouldn't just be for people who have a lot of money.
Exactly. So it makes AFC more accessible.
You got it. And it's not just about individual families either. Research actually shows that AFC can be a better deal financially than, say, putting someone in a nursing home.
Oh, really? So there are cost savings on top of everything else. That's got to be good to know for families, right?
Yeah. While cost shouldn't be the only thing families think about, it is important to understand what different care options will cost, And AFC can be a much more affordable choice while still getting good personalized care in a home.
So we've covered a lot, the background of AFC, who it helps, how it works, and how it's funded. But how does this actually play out in real life? What's it like day to day for the person getting care and the person giving it?
All right.
Okay, so we've got the basics of AFC down, but now I'm thinking about the day to day. Like, what does it actually look like?
That's a good question. And this is where the whole personalized thing with AFC really matters. Because remember, it's all about making the care fit the person.
Right.
So what happens every day can be totally different depending on the person's, condition, how much help they need, what their routines are like, even what they're interested in.
Gotcha. So there's no like set schedule or anything.
Nope, not at all. For someone like Maria, who we know has Parkinson's, her AFC plan might focus on helping her move around, making sure she takes her meds, and doing stuff that keeps her, both physically and mentally active.
Right.
So the caregiver might help her with exercises, take her on walks, maybe chat with her, or play games, things like that.
Okay. And for James, with the brain injury, it'd be totally different, right?
Oh, yeah, totally. His plan might be all about cognitive rehab, speech therapy, helping him with the everyday stuff that's become hard since the injury.
I see.
So his caregiver might do memory exercises with him, help him communicate, and just, be there for him emotionally as he adjusts.
It's pretty amazing how AFC can adapt to such different needs.
Mm-hmm.
But I want to shift gears a bit and talk about the caregivers. I mean, what are they actually doing?
Well, that's where the foster part of adult foster care is so important. You see, caregivers aren't just there to, check things off a list. They're companions, they're advocates. A lot of times they're the main source of emotional support.
Right. The guy talks about continuity of care. That seems really relevant here.
Totally. AFC tries to keep things as consistent as possible for the person, keeping their relationships and routines going. Caregivers become a big part of their life. Sharing meals, doing hobbies together, just being there. That's something that's really hard to do in those big care facilities.
So it's not the typical patient-caregiver kind of thing. It's more like, I don't know, a two-way street,
Exactly. It's built on respect, on really understanding each other. And this is where the training and support from groups like Informatix Health and the state, it's really important.
You mentioned caregiver support earlier. Can you say a bit more about what that actually looks like?
Sure. Caregivers get a lot of training. And it's not just about, how to physically take care of someone. They learn about specific medical conditions, how to handle tough behaviors, the best ways to communicate. They even learn about the legal and ethical stuff. So they can really advocate for the person they're caring for.
Wow. So it's really comprehensive. They're not just learning how to, make a meal or help someone bathe.
Nope. It's about giving them the knowledge to make good decisions, to navigate the healthcare world.
Makes sense. And you said there's ongoing support too, right?
Right. They have regular meetings with healthcare folks, support groups where they can connect with other caregivers and resources to help them manage their own stress. It's about recognizing that caregivers are people too. They need support so they don't burn out, so they can keep giving good care.
Yeah, burnout is a real thing.
Oh, definitely. And that support system is there to try and prevent that. Make sure caregivers have what they need to thrive in that role.
That's a good point. So we've talked about how AFC is more affordable than a nursing home, but I'm curious about the specifics. How do the costs actually compare?
Okay, so let's look at some numbers. A study by the AARP in 2023 found that a private room in a nursing home costs over $100,000 a year on average.
Wow. What about those assisted living places?
Those are usually a bit cheaper than nursing homes, but it's still about $50,000 a year, according to the same study.
Okay, so where does AFC fit in?
Well, it depends on a few things, like how much care the person needs and where they live. But studies consistently show that AFC is way more affordable than both nursing homes and assisted living.
Do we have any, hard numbers on AFC costs?
Yeah, a report from the Scan Foundation in 2022 found that AFC costs about $3,500 a month. That comes out to, let me see, about $42,000 a year.
So even if it's a bit more, it's still way cheaper than a nursing home or assisted living.
Right. And remember, those numbers don't tell the whole story. Because with AFC, a lot of times people get to stay in their own homes. So they don't have to worry about selling their house or, dealing with all that.
Oh, that's a good point. Especially for older folks who've, built up equity in their homes.
Exactly. And it's not just the money. There are all those other benefits too, like, the well-being of the person getting care and their family.
Yeah, that makes sense. AFC seems like a really good option, both for the wallet and, emotionally. But let's be honest, nothing's perfect. Are there downsides to AFC that families should think about?
Oh, for sure. It's really important to be realistic about AFC because it can be complicated. One thing is sometimes it can be hard to find qualified caregivers. The need for AFC is growing, but we need more people to actually do the caregiving.
Right. Just like any job, you need people who can do it well.
Exactly. And then there's the burnout thing, which we talked about. Even with all the support in the world, caregiving is hard work. And families got to be able to spot the signs of burnout, get help if they need it.
So communication is key.
Oh, yeah, absolutely. Being open and honest, being willing to ask for help. That goes for both the caregiver and the person they're caring for.
Got it. Is there anything else?
Well, sometimes the person's needs just get too much for AFC to handle. AFC can work for a lot of different conditions, but sometimes you need, more serious medical care.
So it's not a replacement for a hospital or like a skilled nursing facility.
Right. Families need to know what AFC can and can't do, and be ready to switch to something else if things change, if the person needs more than they can get at home.
So AFC takes planning.
Yeah.
And you have to keep checking to make sure it's still the right fit.
Yeah, it's not just a one-time decision. It's something that changes as the person's needs change. It takes being flexible, communicating well, and being willing to adapt. But, with the right support and everyone working together, AFC can be a really amazing way to give care.
That's a powerful thought. So how do families get started with AFC? What should they do if they think it might be right for them? All right, so we've talked a lot about what AFC is, but let's get down to brass tacks. How do families actually make this happen? Where do they even begin?
Yeah, good point. It's easy to get lost,
Yeah.
But the first thing is, figuring out if you even qualify for AFC, getting all the info.
So where do you even start with that?
The Informatix Guide, they say a good first step is calling your local area agency on aging.
Oh.
They can tell you about, the AFC programs near you and hook you up with the right people.
Gotcha. So it's like having someone local to help you out. What about actually qualifying, though? What do you have to, what are the rules?
Well, usually you got to be over 18, need help with at least one of those activities of daily living we talked about. And, your income and assets got to fit the rules for Medicaid or whatever state programs are out there.
So it's not just about age or health. It's about the money, too.
Yep, that's right. You got to understand how the money part works for AFC in your state. And the area agency on aging can, walk you through all that.
Okay, that makes sense.
Yeah.
But once you know you qualify, then what? How do you actually find a caregiver?
That's where groups like Informatix Health can be really helpful. They've got a whole network of caregivers, people who've been background checked, trained, all that.
Oh, okay.
And they can match you up with someone who, has the right skills to take care of your loved one.
So it's like a caregiver matchmaking service.
Yeah, something like that. It takes the stress out of finding someone because they've already been, vetted.
Right. So Informatix helps find the caregiver. But what about the actual plan for the care? Who makes those decisions?
Well, it's a team effort, It's the person who needs the care, their family, the caregiver, and the medical folks, like nurses and social workers.
So everyone gets a say.
Exactly. And the plan lays out, what the caregiver's going to do, when they'll be there, any special things because of the person's health or, what they like.
So it's like a roadmap for the caregiving.
Yeah, you could say that. And it can change, as the person's needs change or if something else happens.
That's good because, like we've been saying, things are always changing. You've mentioned communication a lot. Why is that so important for AFC?
Well, communication, it's really the foundation for good caregiving, especially at home. Everyone needs to be talking. The person getting care, their family, the caregiver, the doctors. That way everyone's on the same page and the care plan's actually working.
So it's about being open, being honest, and feeling like you can speak up if something's not right.
Exactly. And it's not just at the beginning. You got to keep checking in, talking, and being willing to change the plan if you need to.
It seems like AFC is really different from, putting someone in a facility. It's more about working together, not just having decisions made for you.
Yeah, that's a good way to put it. AFC gives people and their families more control. They can say what they need, what they want, and know that they'll be heard.
This has been really eye-opening. Any final thoughts you want to leave us with?
Well, the main thing is AFC is a different way to think about caring for people. It's about respect, about keeping things familiar, about families staying close. It's not just about, checking boxes. It's about real human connection.
I love that. AFC shows that even when we get older or when health gets tough, we can still have control over our lives. We can still be close to the people and places we love.
And for families who are, trying to figure out what's best, AFC can be a really good option. It puts the person first, keeps families involved, and it looks at the whole picture, not just the medical stuff, but the emotional stuff too.
So if you're feeling lost or scared about what's next, don't be afraid to look into AFC. There's help out there, people to support you, and lots of information to guide you.
And remember, you're not alone in this. Lots of people are going through the same thing, talking to others, asking for help, and just connecting with people. That can make all the difference, especially when things are hard.
Thanks for joining us for this deep dive into adult foster care. We hope you learned something new, and maybe it even got you thinking about how we can all create a world that's more caring and supportive for everyone.